Very good data, and I'm a general practitioner in Album General Hospital. So today we're going to discuss about some issues about being a doctor in Ethiopia, and I hope this video will help um most of the peoples, and especially it will reveal some ideas. So regarding the issue of how long it takes to train a doctor in Ethiopia, so currently in Ethiopia we do have like about 24 medical colleges that teach these medical students. So out of these 24, 16 of them are government sponsored, and 7 of them are private sponsored, and this institution train doctors to make them a good doctor. So when you see the time from their first entry to the university till they graduate, the estimated time to take to be a doctor is about 6 years and a half. Okay, because the first 1.5 years they will stay as a pre-medicine, and the next 2 years they will stay as a preclinical, and the next 2 years they will stay as a clinical year, and the last 1 year they will be an internship program. So nearly they will take like about 6.5 years to be a doctor in Ethiopia. Regarding the payment of these doctors, the bigger challenge in Ethiopia is there are two challenges. The first is unemployment rate of the physician is high. So after passing through these difficult 6 years and getting a job in Ethiopia, especially for doctors, is becoming somehow difficult because of different issues like budget issues and the current economic condition. So majority of the physicians are unemployed. That's the first problem. The second problem, what even they get a job, okay, the payment what they get is, especially for general practitioners, nearly like 350 to 400 USD dollars, okay, per day, per month. So when you calculate this amount per day, it will become like 13 to $50 per day. And for the specialist doctors, and this amount may be increased about 500 to 600 USD per month. So the payment is relatively low as compared to other countries. And the other thing is regarding the patient we see. So currently I'm working in one of a general hospital, and this general hospital served for more than 1 million peoples around the zonal area. So it's one of the referral center. So we see different kind of patients. So nearly in our outpatient department, we will see about 30 to 40 cases per day, and in our emergency areas, we see about 20 to 30 emergency patients per day. And the sort of the patient, so here in Ethiopia, the commonest problem we are facing is regarding the infectious conditions. Okay, so the communicable disease rate is high in Ethiopia as well as in sub-Saharan countries. So regarding these infectious causes like respiratory infectious conditions like acute febrile illness like malaria, urinary tract infection, acute tonsilopharyngitis, and different acute otitis media, we see such infectious conditions. Okay, regarding this non-communicable disease, currently the burden of this non-communicable disease is increasing. So we are facing patients with chronic illnesses like diabetic patient, hypertensive patient with some complications. We are seeing renal problems. We are seeing chronic liver disease, neurology complications, and others. Okay, so we also are seeing patient different surgical conditions like acute abdomen, patient with fracture, and other surgical conditions. So sort of these patients. So as a center for referral, currently we are giving service for this kind of patients currently, and the burden of our patient is high actually. And regarding the number of the physicians, we are currently having these things. And in general, the problem in Ethiopia is even though we are dealing with high patient burden, and it's one only general hospital in our zone, nearly serving for more than 1 million. There is literally a shortage of materials. We are out of, sometimes we'll be out of drugs in the pharmaceutical areas, we'll be out of this laboratory equipment. There is shortage of personal protective equipment even for the doctors, and there will be a greatly shortage of the number of trained physicians. And when it comes to the laboratory environment, we don't have CT scan, we don't have MRI, we don't have these basic investigation modalities to diagnose our patients. So it's really challenging to be to serve our community because of this lack of important materials, trained staffs, and other things. So this is in general what is going on in Ethiopia regarding the doctor's environment. Okay, so thank you for your time. So my name is still again Dr. Edi Mugeta. I'm a general practitioner in Urban General Hospital. Thank you for your time.